But first, I want to shift gears and talk a little bit about what we know about microplastics and their associated chemicals when it comes to cancer risk. So this is a topic that's gaining more attention as new data emerges. As we've been discussing, one of the key concerns with microplastics is not just the particles themselves, but the chemicals they carry, including phthalates and BPA, both which are endocrine disruptors. Because these substances interfere with our hormonal systems, there could be an effect on cancer risk. Let's start with phthalates. So a study published in 2022 looked at about 1.3 million children in Denmark over a 20-year period. The study found that childhood exposure to phthalates was associated with a 20% higher overall risk of childhood cancer. But it didn't stop there. The study highlighted specific cancers, showing that children exposed to phthalates had nearly a threefold higher rate of osteosarcoma. This is a rare bone cancer, and they had a twofold higher rate of lymphoma. So this is a blood cancer. What makes this study particularly robust is the data set. So Denmark has a universal healthcare system that provides very detailed records, allowing researchers to track medication-associated phthalate exposure with more precision. So the findings are very significant because the phthalate exposure here wasn't just environmental or dietary. It was actually tracked through medication fills containing phthalates. So it represented a higher exposure than normal, typical environmental levels. But still, I think these results should make us question what background exposure from our everyday environment could be doing, especially over time. The connection between phthalates and breast cancer is also emerging. A meta-analysis pulled data from 9 case-controlled studies involving over 7,800 participants across multiple countries, and it found that specific phthalate metabolites were positively associated with breast cancer risk. These are the kind of details that matter. We're not just talking about vague associations here. These are metabolites from specific phthalates showing a clear connection to cancer risk. So the question becomes, how much cumulative exposure are we really getting? And more importantly, how does this cumulative exposure build up over years or even decades to affect our cancer risk? Because cancer really does take decades to develop. There's also a growing body of research linking BPA exposure to breast cancer. So BPA acts by mimicking estrogen, which plays a central role in the development of breast cancer.